Let's proceed with Lesson 3, Primary Care, Part 2 of Lesson 3. And in Part 2 of Lesson 3, we are going to talk about the 6 domains of primary care. The first domain is point of entry. Second is community-based. Third is coordination of care. Fourth is essential care. Fifth is integrated care. And number 6 is accountability. Now we're going to talk briefly about each of these domains. Regarding point of entry, primary care is basically sort of like the gateway for everyone to get into the health services system. Healthcare delivery is organized around it. And because it is the point of entry into a hopefully coordinated care throughout a lifespan, primary care becomes the first contact a patient makes with the health delivery system. And for instance, one good example is when a baby that is brought by a parent to see its pediatrician for the very first time after being born. Now that occurrence, that event itself, makes it the point of entry of that baby into the healthcare system. What is gatekeeping? So gatekeeping simply means that patients must be referred to specialists by primary care physicians. And one of the main functions of primary care is to coordinate the delivery of health services between the patient and the different, sometimes confusing components of the healthcare system. And therefore, in addition to providing basic services, primary care professionals serve the role of patient advisor, advocate, and system gatekeeper. So gatekeeping is not just sort of like keeping the gate and not letting you get into other things like subspecialty care. Gatekeeping also provides, primary care provider doing gatekeeping provides advice. They advocate for you. Do you really need this test or don't you? Is it too much? So that's basically what it means. So primary care being community-based, the aim is to bring this point of entry as easy and as close to the population as much as possible. And by making primary care community-based, the goal is to achieve equitable access to all members of any given community, and this should mitigate the effects of the system and the individual level barriers that are inherent in any given situation. So when we talked about chapter 12, when we talked about cost, access, and quality, and we talked about access, we said that there are two different levels of barriers, and some of them, one of them is system and the other is individual. And basically, one of the domain of primary care is to make sure that those barriers are actually broken. In terms of coordination of care, this is actually considered to be the main function of primary care. So this is when we often use the example of a symphony orchestra conductor as the same or as akin or as analogous to your primary care provider. Symphony conductors make sure that all members of the orchestra play their own part in a timed, harmonious, and coordinated way in order to produce wonderful music that is harmonious and coordinated. And with primary care providers at the helm, care then is given to patients that is seamless and coordinated. This is an illustration of how the domains of primary care interact with each, which then produces a well-coordinated care of an individual. So if you have primary care in the middle, there's continuity and comprehensiveness. This is your conductor. Your primary care actually coordinates with the different types and levels of service that you might actually need. Another domain of primary care is essential care. So for countries that align their healthcare system with primary care as central to services delivery, they achieve better health outcomes. It therefore optimizes population health and not just the health of a single individual patient. They also tend to spend less on healthcare in terms of expenditures as part of their GDP or gross domestic product. And therefore, this leads to lower healthcare delivery costs, which then gets passed on to the consumer. An overall result of this is that satisfaction levels with health services are usually higher in this country, meaning the patients are happier with the type of services they get. And the result is the opposite in countries where primary care infrastructure is not strong or well established. Aside from achieving optimized population health, primary care also promotes health equity through equal access to care. Unfortunately, in the United States, the current model we have of mixing market and social justice as two philosophies that guide access to care has led to a fragmented system. There is no really central governing body that coordinates everything in this country, in the United States. So unlike countries with universal healthcare systems, the US government seldom negotiates with the other components of the healthcare system that provides goods, resources, and services that could lead to better pricing. Primary care also leads to integrated care because it promotes comprehensive, coordinated, and continuous care. So primary care is comprehensive because it addresses any health problem at any given stage of a patient's life cycle. This means from pediatric care to adult care to geriatric care, and at any given point in an individual's life, if needed, long-term care. In a coordinating role, the provider refers patients to sources of specialized care. They give advice regarding various diagnoses and therapies. They discuss treatment options and provides continuing care over time. So this also relates to the gatekeeping role of a primary care provider. Additionally, coordination of an individual's total health care needs is meant to ensure comprehensiveness and continuity. So they all actually interact with each other, these different domains. And continuity of care by a constant provider or a constant team that provides seamless care, results in better healthcare outcome. This also fosters a lasting relationship between the patient and the provider. Last but not the least is accountability. So finally, this is the last domain, and basically, this refers to providers and patients being both accountable in this relationship. So this is not a one-way street. Healthcare is a partnership, especially with primary care and a patient. And the provider, on behalf of the healthcare system, is responsible for first quality of care, patient satisfaction, the efficient use of resources, and of course, professional and ethical behavior. Now, as a patient or as a consumer, we are held accountable for our own health up to the extent that we can influence it in ways that are within our means, things that we can do. And also, part of our responsibility is using healthcare resources judiciously, not wasting resources. An example would be using urgent care for non-life-threatening illnesses instead of going to the emergency department. In the end, primary care is really a partnership between the provider and the patient. So each one has a unique role to make sure that care given is successful. And paternalism on the part of the provider does not result into good health outcomes. When your healthcare provider acts as if he's your father and tells you what to do, it does not promote mutual respect, trust, and responsibility on each other's perspective. So this is the end of lesson 2. End of part 2 of lesson 3.